Now can you guys hear me? Hi. I knew I was talking and you weren't hearing me, so I'm glad I got my audio fixed. I'm Ashley White. I'm AOPA's Director of Strategic Alliances, and I can still see that some are joining. So I'm going to give a few more minutes to let attendees join, and then we'll get started with the tutorial. If you have any immediate questions or if you're having trouble getting connected, if you don't mind popping a note into the chat function, that'll alert me and let me know that you all are having issues. Additionally, if you have specific questions about the co-op or co-op tutorial or the content that we are going over at the moment, if you'll pop those into the question function in your panel, we can actually export those questions and it allows us to follow back up with you if there's more detail needed. So the chat function's great to just like give me a heads up or something like that. If you want your question logged and for us to make sure we can follow up with you on it, if you'll pop that into the question section, that'll be the best place for it. So I make sure I get all questions answered for everyone on the tutorial. If anyone's having trouble hearing me now, please let me know via chat because I want to make sure that that you all can hear me and that you can see everything. I'm going to share my screen shortly. It looks like we have a couple more people joining, and then we'll get started. I'm going to pop in here and change my email address. So you should be able to see in the attendees staff section the name and email address. I'm just going to change that really quickly so you all can see my email address. It's awhite@aopanet.org, and that way, if you need anything, you can just shoot me an email if you want to talk privately or offline. Okay, great. Looks like everyone that was joining is in. I'm going to go ahead and share my screen and get started. A couple of housekeeping items. If you want to use the raise hand function to ask your question verbally, I can also unmute you and let you do that. But again, if you want your question logged and the potential for follow-up, I would stick that into the question section of the panel. That way because we log those. Okay, so I'm going to go ahead and share my screen and get us started. I'm going to do something a little differently this time. So I hope you all can see my screen. I'm going to turn off my video camera. Can you let me know if you're seeing my screen right now? Anybody there? Can you let's see here. Yep, great. Okay, Molly. So I'm starting a little different this time around. I'm going to show you the quiz first because a lot of people have asked me if you know, I know there's a quiz, did we answer all of those questions? And I think it's really important that we make sure that we're covering the topics that are in the quiz, right? So we're going to talk about the L code, the area where the L code and the code descriptors are. We're going to make sure we cover that. We're going to talk about the co-op and how you can search it. We're going to talk about that search feature pretty intensely on this tutorial. We're going to do a breakdown of the local coverage determinations and where those live on the co-op. We're going to answer the question about contributions from you all and the value of those. We're definitely going to hit that date time stamped for updates piece. We'll talk about the icons and what they mean that are located throughout the co-op and the topics that are covered on the co-op. And we'll make sure to even talk about certain specific topics like the VA and information on different sections of the co-op, like the state pages. And obviously, I will say up front that all the content that is posted in the content section of the co-op is always going to be vetted by our reimbursement, coding, and billing staff at AOPA. So there are no members that have direct edit access to the content that we're going to share with you that is shared on the co-op. There are comment areas at the bottom of every page and direct inline comments that can be made that are not vetted, but those are vetted as we receive them. So the content, you'll get an idea, get a feel for what that looks like. So thought I would share the quiz up front. I'm going to copy and paste that over into the chat function for everybody. So there's a link to that quiz in the chat function now. Everybody can access that. So I'm going to go ahead and back out of here. Again, some more housekeeping. If you are not currently signed up for the co-op or not sure if your company is signed up for the co-op, you can go to aopanet.org and you'll see there's a button right here that says co-op. And if you click on that button, it's going to provide you additional information about how to sign up or to sign into your account. If you don't know if your company is already signed up, you can use this function here and put in your member ID, and it'll let you know if someone's already signed up to your license for the co-op. Every AOPA member and every AOPA affiliate member gets a license to the co-op, a single license to the co-op. So how you distribute those and how you allow your staff access to those licenses is completely up to you, and we leave that to our members internally. But it's built on a platform called Atlassian, and Atlassian Confluence is a Wikipedia style tool. So AOPA pays per license. So for every person that registers their license, AOPA is paying a licensing fee for you to have access to it, and that's why it is a members only AOPA benefit. So again, you can go to aopanet.org, click on co-op button, it'll take you to this page. And on this page, there are some videos with really specific, tips like email tips and, a little bit of overview about what the co-op is and so forth on that page as well. Great, so that is taken care of. All right, so now we're gonna jump right into the co-op formally. Now, this should be the page that you land on here when you log in. If you're logging in for the very first time, you may find that you end up on your profile page. Now, unfortunately, this is my account, so I can't, my profile page is going to look different than yours because I've filled it all in with all of this information. When you very first log in, you'll have 4 boxes up here at the top instead. And those will walk you through setting up your profile. Don't get stuck or bogged down if you're in that very, very beginning phase, because it allows you to put information and organize the information that you want to have on screen for you. So always just know that if you click on home, this is going to be the page that you see. Now, you probably won't see Compliance Handbook or AOPA Library on yours. You're only going to see the AOPA Co-op because that's the tool that we're actually discussing today. So I'm going to click on AOPA Co-op, and this is going to be the home page for the AOPA Co-op, or the content section of the AOPA Co-op. So I'm going to back up again and share that part again. So you'll see over here on the right-hand side that you have an update feed. This update feed gives you time-stamped information about when things have been posted, when comments have been made, what information is currently being worked on, what people are asking questions about. All of this information over here is a running log of the activity on the co-op, and can really help you understand, when was the last time AOPA updated, the spinal LCD page, and you'll see that that was updated on August 11th. You can also see by popular, you can see what pages most people are visiting and where that interaction is happening. Over here where it says recent pages, these are your recent pages. So this is going to be where you've recently visited, and you'll see I'm in here a lot, so I've got a lot of recent pages visited. And then you can also see what you've worked on. Now, if you made comments on something, you will have those pages where you've made comments. Those will be in your worked on pages. They'll be listed there. So if you remember, oh yeah, I made a comment on the co-op on a certain page, it will be listed under your worked on section there. You can also star pages, and I'll show you. See the star here. If I'm on the State Matters page, you can star by clicking here, and that will show up in your starred section. Starred are different than watches. So watches are an actual notification mechanism. If you're watching a page, so say I want to watch the State Matters page, that's this eyeball icon. The eyeball icon, you can either watch a page or you can watch all content in this space. This space is the AOPA co-op. That is the home base. So that is the space. If you're watching all space in this all content in this space, it means you're going to get an email every single time one of these pages is updated. So if your job is specifically encoding and billing for Medicare and private payers, and you only want to watch the Medicare page here and maybe the State Matters page and maybe the commercial payers page for the big updates, then you can set your features to only watch those pages. You can do that by when you're on the Medicare page, clicking to watch it or unwatch it by unclicking. That means you'll no longer receive email updates about that page. Or you can go to your settings under your profile. You can go into settings and then you can go to watches. And under watches, you'll have all of the pages that you're currently receiving updates for. And if you feel like you're getting too many emails and you don't really need emails on EASE, or you don't really need email notifications on cranial remolding orthoses, you can stop watching that page. The thing that will happen if you stop watching is that you will still receive the digest email that tells you all the places that have been updated in a 24-hour period. You can still get that email. You just won't get an email as soon as that update is made. Okay, so are there any questions about notifications? Because I'm going to share an example of a notification of an actual email next, but I want to make sure there aren't any specific questions about how you get email notifications. Let me look. Okay, I don't see any. Great, we're going to keep rolling. So I'm going to share a few examples. I've got 3 examples here of emails, and these are each of them are a little different. So this morning or actually yesterday, I made an update to the audits page. So we found out back in April that they were going to suspend audit activity. So when we're going through the sections of the co-op shortly, you'll understand where this content lives. But if you were just signed up and you haven't explored at all, but you're getting your email alerts, you would have received this. And why this looks so funky is because it's actually telling you, the viewer, what work I or Devin or Joe have done on the page itself. So what I did was I removed this April 2nd announcement because it's no longer relevant. I added this announcement here about the fact that we understand that that this activity is going to resume, and that what they're suggesting one of the first categories will be. And this announcement, it's linked here. The CGS Medicare announcement is linked right there, so you can go to the actual announcement. Now this is complex post-payment review for L0650, and that's an off-the-shelf LSO. So you've got all of the most important information that you need, and you just got that in your email. You didn't have to go to the co-op to get that information. That came to you in your email. Anything that's red means it's been removed. Anything that's green means that it's new. And anything that you see that's highlighted in blue, it means that it was already on the page and it remains on the page. So it's not new information, but it's still there on the page. It's still relevant. And you can go directly to that audits page by clicking view page on that email. So here's where I made that alert. Again, we're in the co-op. This is the co-op categories of information over here. Now, say I didn't know where to go, but I know that someone said, hey, there's been an audit update on the co-op, but you didn't get the email. So all you have to do is go to your search feature and type in audits, and the first thing that's going to pop up is the audits page, and the first thing you're going to see is that alert. So if your colleague is saying, hey, there's been an audit, there's been an update to audits, where is that going to be located? It's going to be located on the audits page, and it's going to be right there at the top. Any new pressing time-sensitive information is always going to be on top of the page. All right, I'm going to pause and see if there are any questions about how the emails work. I'm going to share a couple others, but all right, no questions yet. So another example of an email is something a little less, pressing in terms of immediacy and your need to see it. You'll see that we have a research and quality section on the co-op, and we just announced our Kobo pilot grant awards. Now, this is a big program for AOPA. We fund a lot of research, and so we want everybody to know what programs have been funded. And if you click here, it's going to take you to the official announcement of the award report, and you'll see what studies have been funded for pilot grant funding. And again, this is not going to be as pertinent to some of your work, but your clinicians might find that very important, because they may say, hey, we're having a hard time getting vacuum assisted socket suspension paid for. What's going on? Who's doing something about this? And I can tell you, we're doing a lot on vacuum assisted socket suspension, but specifically, we're also funding some research on this. So there are multiple ways that AOPA is working to try to improve the reimbursement environment for you all in practice. And then another alert that I just made this morning, and one of the reasons that I'm bringing it up is because as a person that has worked in a clinic, my family owned an O&P practice, and we owned that practice for 25 years, and we sold in 2015, and the company that purchased us purchased us all 5 clinics, and I went back to work for them as a director of operations. And in that role, I recognized that I really wished I had a tool that contained all of the information I needed to really to do my job as a director of operations, to help different people get the information that they needed, different people in my company get the appropriate information that they needed in a timely manner, whether that was to help them with their notes, to write documentation for medical necessity, or if that was just understanding how to bill a SNF, a skilled nursing facility. So those, or if they were a practitioner or even an intern, and they needed some coding guidance, what is the descriptor for this code? I wanted to make sure that I was getting the right people the right information, and that was hard to do in that role, and especially for 5 facilities. And so when I started working at AOPA, it was a perfect opportunity. This was the brainchild of one of our board members, Michael Oros, and he said, we really should create this compendium of information. And so the reason I bring that whole story up is to say that as a member of the staff at AOPA, I am not sure if the fact that there is a stroke committee meeting for the governor's EMS and Trauma Advisory Council that's happening in Texas, I'm not sure if that's going to be relevant for our Texas members. But if there is an opportunity for an orthotist to have an impact on some of these conversations that might be happening there with respect to post-stroke Medicaid specific intervention, Medicaid coverage of post-stroke intervention, and AFOs being utilized for that intervention, I want to make sure that I'm letting our Texas members know that this is happening in their state. And so this is kind of a hyper-specific example of, hey, there's a meeting happening in Texas on 8/18 at 2:30, and I'm not really sure. I can't tell if this is valuable information for you or not, but it struck me that it might be, and so I'm sharing it on the Texas page of the co-op. So when I tell you that the types of information we share is vast, it really is. I don't know what's going to benefit you in that moment, but if it might impact your practice or it might impact your ability to get something covered by Medicaid, I want to make sure that you have the opportunity and in advance. So as soon as I got this notification this morning, I pushed it to the Texas page on the co-op. That is an example of how we at AOPA are sharing the information we receive with all of you. Okay, so we've gone through these different email examples, and now we will, I'm going to break for 1 second, see if we've got questions, no questions, okay, and then let's just keep rolling here. So I'm going to back out to my home page. and start with some functionality. So when you click into AOPA Co-op, if you find that you don't have a margin over here, it may be because you may find that you're not expanded, your menu is not expanded, and that's this blue arrow here. Now, every computer functions differently. Some of you have to click on that. Some of you can just roll over top of it. Some of you can tap on it. It really depends on how you have your computer set up. But for the most part, it should open with this open. I have never experienced where mine wasn't fully open on my computer. I did get a question about it once, and they said, I don't see the menu over on the left. It's because this blue thing was collapsed. These categories are the main categories of content that are on the co-op. The reason they're organized this way is because this is how we view policy work at AOPA. So when we talk about Medicare, we talk about all the things that live under Medicare. So there are audits that are under commercial payers as well, but these are the specific types of audits that live in the Medicare world. And if you're on the Medicare page, as always, you're going to find those big, important, alerts that you need to know about the most, and those relevant things are going to be at the top in the alert section. There might be another, this is a tip for anyone that wants to dig into some CMS data. AOPA has made the CMS data portal open free to AOPA members, and you can log in and unlock that data. It's a free membership benefit there. Again, there's COVID-19 updates. All of this stuff at the top is going to be like what's most relevant. But if there were no COVID-19 and there weren't a ton of Medicare action items happening right now, this would look a lot like Wikipedia. That's the reason that we chose this platform, so that it could function like a Wikipedia. And you would find that the description on the Medicare page is actually about the Medicare program and how it interacts with O&P. Who is responsible for making sure that Medicare beneficiaries receive O&P care? That's both at the congressional level and at the contractor level. So you'll see that we have a description of the rules, why people have Medicare benefits, how that works within the O&P space specifically. And then this is just generic eligibility information. And then over here is a child list. So these are the pages that are related to Medicare, and each of those are going to be over here. So these are the main categories. But again, you'll see on the left, you can really dig down further. So we'll have RAC audits, CERT audits, ZPICs, prepayment audits, internal audits, TPE audits. I'll go to TPE for a second. We release their quarterly TPE results on that TPE page, but we also have a general description of what TPE means. So what we're finding is a lot of front office staff, patient care coordinators, those types of individuals that are just starting in O&P, and they may have come from a dental office or another healthcare space, are using the co-op to train. They're using the co-op to learn terminology and to understand a little more about what all this means for them in their day-to-day work at an O&P facility. So if you were on the audits page and this announcement wasn't here, again, it would look a lot like a Wikipedia page. Everything blue is going to link to something else. And you'll see that this is the audits page information without that alert, that alert just scrolled up there. Claim submission. So again, this is another big category. These are all of the pieces of content that are underneath the claim submission category. And I think it's relevant to know that some of this information, some of these secondary things, are the most utilized pages on the co-op. I'm going to share a couple of those, but it doesn't, it always surprises me when I look at the analytics, what has been used and what hasn't. And a cool tool you have, if you're interested, because everybody likes to poke around a little bit, you can look at analytics too. You can see when people have clicked on something. So we had a hospital update recently to our hospital page, and you can see, I bet you'll see a little jump on that. See this little jump right here? on Monday, it's because I made the update on Monday. So we had 14 people that logged directly into this inpatient billing hospital page on that day. And I just think it's neat to be able to see that information kind of if you're using it and like, okay, my colleagues are also going to this page. It's got relevant information on it. A few of the biggest claim submission pages that get visited are the inpatient billing, that hospital one, as well as the skilled nursing facility one. And the reason I brought us to the skilled nursing facility page is because we also link tools that were created outside of AOPA. I wish we could claim this one. I wish we could say we created the consolidated billing tool, but we did not. But this will take you to the CGS Medicare webpage, of course, except and this is a consolidated billing tool. You put your HCPCS code in here, it will search the consolidated billing tool and it will apply your rules. It will tell you the rules specifically related to your HCPCS code. It's a really cool tool and one that we try to encourage our members to use. And so yeah, I wish we would have created it. We didn't, but we still want you to have access to it, and we still want to make sure that it's living in the area of content that is relevant. Another cool tool is on the modifiers page. Again, I really wish we would have created this, but CGS has a tool for the advanced modifier engine. Now, obviously, we've put lots of information about modifiers here, why and when to use them, what they mean, all of that on the modifiers page. We also have an opportunity to get some CE credits if you take the quiz that's associated with this article. That's from our almanac. But this advanced modifier tool engine is really cool. So again, accept the terms there. This is CGS's. You put in your category, you put in your code, you put in your scenario, and it will tell you what modifier you need to use. A really, really cool tool. So I like to think of the co-op as the place that you would go if you wanted a Google for just O&P. If I wanted a place where I could find everything I need, so I remembered, okay, Ashley said something about advanced modifiers, and that was in claim submission. I don't remember, what did she say? Advanced modifiers. And then look, it's the modifiers page right here. If I had continued typing advanced modifier, it would have brought me directly to this page. So the search feature that's designated by this little magnifying glass icon is going to be a great tool for you to use if you can't remember where something lives. We do have outpatient information too. This is right out of every time we have information on here, you'll see a source cited or a source cited within the content. And the reason that we do that is because we want to make sure that you can reference where this information came from. So if we say AOPA has reviewed, some of the alerts will say AOPA has reviewed and our understanding is X. That means that an AOPA expert like Joe or Devin have reviewed a document and that's their opinion. But when you see a source cited or something linked, this information is directly from that source. So it's important for you to know that we're getting this information from validated sources. And we have a prior authorization page here. You'll see we've got lots of updates on that a lot of updates on that prior authorization page, including the 6 codes that are eligible for prior authorization in the upcoming rollout. Let's see. Really basic information is here too. Assignment and non-assignment of benefits. This is something that I remember going over with staff, and it's just great to have a source for it. And an explanation for that information right there. If you've ever attended a coding and billing seminar, Joe and Devin do a really deep dive, a really great deep dive, in-depth training over 2 days on a lot of this information, and they provide a big manual. It's like a really big book. What we've done is taken that really big manual with all of those step-through processes and distilled it down into pieces of information that'll help you get the answers that you need. And that information is contained here on the co-op. All right. So I think, we've kind of gone through claim submission and audits. I'm going to pop into this coding section for a second and we got, again, updates here at the top. Always good to know when those updates happen. Again, these are the areas under coding. So these are the pieces of information that live under the main coding section. But we do have a great little description of the coding history here and coding principles and all of that is on here. How add-on systems work. If people are coming to you from other spaces and they're used to doing diagnoses codes and CPT codes, they may need a little primer on L code, the HCPCS system, and this has got a lot of valuable information on it. We also push all of our coding change and documentation to this page, so you'll see when coding changes are made. We put this up every single quarter, every year when the announcements are made. And sometimes there'll be a mid-year announcement and there'll be a temporary code assigned, and that will also have its own designation for coding changes. We have information about the PDAC. We've got some really recent updates to the PDAC information. You can see that this page was updated on August 4th, and there as much information as we can share right now. We're still working with our supplier and manufacturer partners on this issue, but a really comprehensive page on the PDAC here, and in addition to how this affects the lower limb prostheses Medicare medical necessity policy, so the local coverage determination. We have the quick coder. So if you've ever purchased a quick coder from our bookstore, it's that laminated bound coding descriptors list. And I remember in practice, I would find that in the lab on a bench with plaster on it. And I'd have to scrape the plaster off so I could get to the content on it. We recreated the quick coder in this virtual platform. And one of the reasons that I always go to this page is because there is an app that you can have on your iPhone for this. It's called Confluence Cloud. It's accessible on that aopanet.org page. You can click on it and download it right there. You can there's also tutorials that walk you through how to add the app, get the app, and log into your account. So we've provided that information. But you can imagine, instead of having to try to find your quick coder in your office, you can just pull your phone out and go to the Co-op Confluence Cloud app, and you'll find that you can click on your quick coder and you'll have that information there. So anytime you're looking up a code, also, it's always going to bring the quick coder up. So say I wanted to look up cranial orthoses, I'll go to S1040. This is all the places that S1040 is mentioned. Minnesota has had quite a bit of action on cranial. They had a policy update in that state to Blue Cross Blue Shield. They also had a reimbursement increase for Medicaid in Minnesota. So they're at the top because they've had the most action most recently. But from a coding perspective, that's where we are, and that's the coding page there. And you'll see the AOPA quick coder is listed there. So that's going to be in the quick coder. We also built in an L code search feature. This is similar to what you find on lcodesearch.com. We have a couple of updated features on this L code search feature, and those are related to our Supplier Plus membership. So if you are, the cool thing about this is that you can organize by product name, or you can organize by manufacturer, you can even organize by L code. And over here in this detail section, this is the Supplier Plus benefit. So if you are a Supplier Plus member, and I'm going to go to one that is, Allard is a AOPA Supplier Plus member, they can link for this product right here, which is PDAC verified, must be PDAC verified to be on the L code search feature. They can link directly to the website where that product is listed. So you'll see they link directly to that product. And again, they have all of their links provided there. And that's a new feature that we've offered to our Supplier Plus members. Let's see. Yeah, we have all of the categories that are listed through the PDAC listed in the L code search feature. There is a correct coding initiative. Sometimes this is referred to as the NCCI. I don't know how much you guys dig down into this, but there's a procedural information listed here, and sometimes you'll hear MUEs and the development of MUEs and the MUE lookup tool and all of that. All of that information is provided on this page. We are working on a specific page for MUE because we get enough questions about it that we felt like we might want to move the medically unlikely edits to its own page. So that's a page that is currently being drafted. All right, so moving right along to documentation. We have as always, your alerts about documentation are going to be posted at the top. But this is the generic information that would be here if there wasn't this alert about the new, what we call significant changes to the requirements for physician orders here, where we do the walkthrough on that. This would be what you would see. So you would see information about your verbal or preliminary written orders, your detailed written order, your proof of delivery documentation, and signature requirements. Those are all pages that are listed under here. You'll also see that in medical records, we talk about physician medical records and O&P clinician medical records, and then other, you can use other types of medical records to support the delivery of the devices that you all deem appropriate for your patients. ABNs, this is again a page that people go to regularly to train, and I don't know if you all heard, but there was an ABN form announcement, update to the ABN form announcement, and there is a new, also I think that has been delayed. The requirement to use that form has been delayed due to COVID. So that will be a new educational piece that we'll post on there with the exact dates of when it will start and when it will move forward. We provide some external links on here, but again, I think those also have their own pages. So we just do this external links because it seemed like a good thing to catalog for everyone. Glossary of Terms, this is another page that we see used frequently for training, and it's because Medicare has some specific language that's important for your staff for you and your staff to understand and know. We have Glossary of Terms for Medicare, for private payers where they have one published, as well as for the VA and DoD. And what we realize is that VA DoD language and terminology is different than Medicare, but it might mean the same thing. So it's important to kind of sometimes look and compare and make sure that if you don't understand a term, you think you know about it, you just pop that term in here and it'll take you directly to the Glossary of Terms page. It'll give you that option. Okay, so here's where we get into some areas where I start to get some questions always on this tutorial. So I'm going to check and see if we have any comments or questions. None yet. Okay, these are the LCD, the local coverage determination and policy article pages. And what we've done and what Joe and Devin do regularly when we see a policy article updated or a local coverage determination updated is we update the information that's here. So you can see this was updated on July 1st, and we put the policy revision up here in the top as an alert. But if that alert wasn't there, you'd see that it would be broken down as a description of what this local coverage determination means, and also a breakdown of each section of the LCD. Now, the LCDs are also linked at the bottom, but these definitions are relevant as you walk through the LCD. So it's, again, a great tool for training on local coverage determinations. We break it down even more into a few different categories. So for AFOs not used during ambulation and AFOs and KFOs used during ambulation. We've got the coverage, the documentation, and the policy-related coding there for each of those sections. How to bill, that's you can expand that out. There's some specific billing requirements and also billing limitations and exclusions that you should know about. And then there's a correct coding and revised statement here. This is just a PDAC advisory article that's related to this. So we try to put that documentation there. So this will take you to the full LCD on CMS's website. and this will take you to the full policy article. And then we have the Clinicians Checklist linked here, and we had that linked at the top as well. And these are documents that are provided directly from CMS. This one, in this case, is Noridian that provided the information from Noridian's website. So those are all of your LCDs. We include information about LCD and policy article breakdown. What is the difference between an LCD and a policy article? Why is an LCD important? This is essentially what is an LCD. So again, we've got the most basic information here and the most detailed and specific information on this compendium. Yesterday, I saw, maybe it wasn't yesterday, it might have been the day before, I saw a post on the listserv. Now, AOPA doesn't run the listserv, and we kind of have a company policy of not, I mean, it's not good form to always respond to things on the listserv because it's not our, we don't have any control over it. So it's not our platform, and therefore really hard for us to communicate with our members that way. We prefer to have direct communication with our members. But I did see someone post on the listserv, and I thought I would just send a quick note to that person if they are an AOPA member that we have this page that's dedicated to incarcerated beneficiaries. The question on the listserv was, once a person is incarcerated, they no longer have Medicare benefits, correct? And that is not correct. They still have Medicare benefits, and this is how those benefits work. So again, you have access to those answers to those questions right at your fingertips here on the co-op. We do have Medicare as a secondary payer. Information about crossover claims and things like that are spelled out here. And I think there is a managed Medicare page that we're working. This section is definitely under construction. We are learning more and more about these Medicare Advantage plans. And what we find most often questions to AOPA is, how do I combat a Medicare Advantage plan that I don't think is following the rules? And so most recently, I think I put, on August 7th, I kind of dug in and found all of this information about the rights and protections and what are the rules associated with Medicare Advantage plans. And those are all listed out right there. And I think, if you are following a section, like if you're following, in this case, well, that would be a managed Medicare. If you're following the Medicare section itself, and I publish this new page, you should receive an indication, an email alert that this new page has been published. All right. You guys are quiet today, no questions. Well, I'm happy to have you all, and I hope that I'm providing some information. So this, you'll see, we could go on and on forever in this Medicare section. It goes and goes and goes. Medicaid is a little different. We have your generic information about Medicaid. Occasionally, if someone asks us to post an alert at the Medicaid level, page level, we will. But for the most part, this is going to be your generic information about how Medicaid works with Medicare, and you can look up your state's Medicaid information for O&P here by clicking on this link. But where you're going to see the most interaction about Medicaid is going to be on the state-specific pages, because most of the time, if someone's saying, hey, I'm seeing a lot of Medicaid audits in Florida, it's really hard for us to validate that in policy. And what we want to live on these pages is the policy, like where we can cite a source. This is directly from the Centers for Medicaid and Medicare and Medicaid Services. This is what they say about the policy. And when someone says, oh, we're getting audited by Medicaid, I have to research that to say, are they being audited by a Medicaid MCO? Are they being audited by a contracted insurance third-party administrator? Like, what is actually happening? And so we don't publish a ton of that information here because, frankly, it's not policy. It doesn't rise to the vetted level of policy. But we do encourage you all to be having those conversations on your state pages, because that's where you might really find out something is going on. There are two ways that we see this happen most often, and I'm going to go ahead and skip ahead a little bit and show the trending topics page because it's relevant for this conversation. So Scott Williamson posted that he is wondering if people in Florida are seeing an increase in Medicaid audits. And he links to their handbook here, and he he kind of posts that, and I say, yep, we're receiving feedback from 2 providers in Florida. They were experiencing increased audits and denials. We think that this is actually part of or in response to some of the recent OIG activity at in Florida. And so then we see that Brian Weaver writes back and says, I'm not located in Florida, but I'm definitely seeing audits from Medicaid HMO, and they're using Performant for case audits. So now we have a little more information about what's happening, and it's not just happening in Florida. So this is on the trending topics page. It allows people that are actively using the co-op to have a conversation with each other. But then also what we're asking you to do is give us some proof, give us some support. And then now our staff, Devin and Joe, are digging into this issue specifically. And once we realize, hey, 2 or 3 members have reported on this from Florida, and I'll pop back up into our State Matters section, and you'll see that I've posted that on the Florida page. So in trending topics, I say top concerns, AOPA members are reporting increased Medicaid audits and denials. And we're researching this issue. And then I linked to that conversation in the trending topics. So again, there's a lot of management going on the AOPA side for this content. And the point is that we want you to have hands-on access to what is happening in O&P in every way possible. We want this to be a valuable tool for you. We want you to be able to use it in whatever way makes sense for your specific job role, but also so that you can be a contributing member for AOPA and for your own practice. If you feel like learning about something on AOPA's co-op will be a good topic for a staff meeting, or you want to bring it up at the beginning of your next WIP meeting, or whatever it is that you're engaging with people inside your own practice, whatever this tool can help you do that better, do that piece better, we want to make sure that it's here and working for you. A couple of extra little fun pieces here. We have this member to member section, and we have this disclaimer at the top. These are resources that people have sent to us that they are either providing for free to their colleagues, other AOPA members, or are always existing as free resources. And what we did was we kind of created this COVID-19 member generated resources here. Now, these are internal. Ability has offered these are internal documents. These are emails and documents about how Ability, is managing the COVID-19 pandemic. This is a PowerPoint. It says confidential at the top. I mean, this is something that Hanger said to us. You all can share this information with AOPA members because we want, we know that this is challenging, and we want to make sure that you have that everyone can see how Hanger is responding to this. And Sam actually sent us this directly, sent it to Eve, our executive director, and said, please share this on the co-op. So, and then we asked Glenn here for permission to share his email. He sent Eve an email saying, hey, I'm taking advantage of this moment and really, offering my skills inside the hospitals. And I think it's improving my relationship with my referral base. And maybe that's something valuable for AOPA members to know. So these COVID-19 tidbits are really interesting and have provided a lot of insight for us at AOPA. We are not in a patient care environment every day, though we spend some time in patient care environments, and we definitely speak with a lot of you all on a regular basis. We aren't experiencing it anywhere near the way that you are. And so every time you share this information with us, it helps us be a little more knowledgeable about how to help you through these challenging times. And then the other resources that are on this page, which if we weren't in a pandemic, this pink section would completely go away and you would just see this section. And these are just resources that people have shared with us that they've developed that are free to the entire profession. So Hanger's Power Up series is one, OSER's R&R is another one, SPS has their clinical services online CEU courses that are available to the whole profession. So again, member to member section, really fun. If you are currently operating a resource that you want to provide to the entire profession, feel free to reach out and we'll put your logo up here and we'll put a link to it. We want to make sure that, like, again, we're sharing information with each other. It makes us stronger together for sure. Okay, so I know I powered through that last bit. I wanted to leave enough time for questions and people to raise their hands and speak verbally. We always get the commercial payer question. This section is always under development. Commercial payers are always changing their rules, their practices. We do on this, I went to the Blue Cross Blue Shield policy page because it's important to know that we do a lot of work towards commercial payer advocacy. And when we do something really big, like submit a letter or have a meeting with a payer on a review of their medical policy, we post about that. But you'll see that Blue Cross Blue Shield is a big company with a lot of independently run organizations. And these independent organizations here do not have to answer back to the main Blue Cross Blue Shield office. They can develop policies on their own. So when we look at policies, we're drilling down to what is the actual owner of the insurance plan, which in Blue Cross Blue Shield's case is an independent owner in most cases, and what plans are affected by that medical policy. And that's the kind of advocacy that we're doing. So the commercial payer page is going to have a lot of that information on it. But remember, commercial payer information is always changing. They update their policies sometimes as often as quarterly. Okay, I'm going to stop now. Okay, here's a great question. Is there a document that went along with the webinar for reference? Good question. We do these updates on a regular basis. So we're doing them once a month. And I realized that it would be probably valuable to have a walkthrough type of PDF or Word document maybe. The reason I haven't created one is because the minute I screenshot something for that, I am afraid that the content that I screenshot might actually be outdated. And I don't want someone to say, hey, that's not accurate. That's not the code, or that's not the descriptor. You know, what I don't want to do is create something that is floating out there in the world when this is a living, breathing, constantly updated platform. I don't want to do anything that might imply that it's not being updated regularly. So that's why I haven't created that reference document. But what we do have is a recording of this tutorial. So not the one that we've done today, but the one that we did on July 24th, we recorded, and I can absolutely email you that, the recording of that webinar that you can share with staff. And the video tutorials the little snippets that are on aopanet.org. Those are small, short snippets of detailed, specific information, like tips and tools of how to use the co-op. And I will consider creating that document, maybe even at just the basic level of the left and right and how-tos that are tech specific and not content specific. So thank you so much, Wendy, for that question, and I will absolutely work on something that can coordinate with this and send it your way. Let's see, training events put on by AOPA. Is there a place on the co-op where we can find educational events like this, like an events page, or the website to better place to search for that? Yeah, the website is going to be the place where our communications director is updating the events calendar regularly with these tutorials and all of the other education opportunities that AOPA offers. I will put a little plug in. Our AOPAversity right now is free for members. So every recorded course on AOPAversity right now is free for AOPA membership. That is not always the case. Those courses run between $50, maybe some are $25, but between $25 and $199. If you're not a member, each course can be up to $199. So that's an incredible value that's on AOPAversity right now. And that can be found at aopanet.org under education. Yes, so I'm going to show, this is a great question. This is exactly why I love these questions coming in. Awesome. Okay, so the question is, can you show me again how I can see what emails I'm getting in the email updates? And I'm going to show you that right now. So if you click on your profile, which is going to be up here on the right, you should, this top bar should always be the same no matter where you are on the co-op. See, this will scroll under it. This top bar should always be the same. So you can either do it from the home page, or you can do it just by going to your profile right there, going to settings. And if you're sorry, before I do this, if you have your little panel, your panel is expanded right now, it might be blocking my, so what I'll do is, let's see, I'll scroll this over here. So can you see the right edge of my page now, just in case your panel might have been blocking it and you didn't collapse it? This is your profile. And then you'll go down to settings, and that'll open up your settings page. Okay, now I'm going to drag this back over here. Under settings, you'll see here are some different settings. Watches is the area where you'll list out all the pages that you're receiving emails on. Now, if you want to watch everything on the co-op for a little while and just see if it's too much, you can. When you're on one of the pages, say you're on the any page, you can be on any page at all. You can go to the eyeball here and you can say watch all content in this space, and it'll watch the entire co-op. And then you can say, okay, I'm receiving too many emails. Let me go to that area in my settings and change how many pages I'm watching. Let's see what else we got. Very fun. How do we get courses on AOPaversity? Great question. So I'll just do that. That's something I'd like to share. So I'll go to aopennet.org. All right, so go to aopennet.org, under education, AOPaversity Learning Center. Click on that, and here is all the information you need. You can register for your free account. They'll talk about all, like, here's your member cost. Everything's going to be zeroed out in your member cost right now. We even lowered the rates for some of the non-member stuff just because COVID-19 has impacted O&P so much. But as a member, everything here is going to be free. And these are all the courses that we've got going right now. There's a lot in here. We've got clinical and business credits available. So please, please take advantage of that. Awesome. Okay. I'm still here. I'm going to just stay around until 1. So if there are any questions or chats you want to send me, I'm here and happy to answer any more questions for you all. I'm so happy that you could join me probably during your lunch hour on this Friday. And we have another tutorial coming up. I think it's, let's see, on September 18th. So if some of your staff didn't get the opportunity to attend today and you want them to train on it, again, you can share your credentials for logging into the co-op with as many people as you want. And you can also all log on at the same time. There's no, there haven't been any reports of challenges for simultaneous logins, so you shouldn't have that problem. Thank you all so much. I appreciate you being here today and going through the tutorial with me. And I hope that you will make use of the co-op, and I hope that it continues to be a valuable tool for our membership. Again, I'm Ashley White. Thank you so much for joining me. Have a great Friday and happy weekend. Bye, everyone.